My name is Tom Kaplan. I'm the managing partner of the Indiana Hand to Shoulder Center, which is a division of OrthoIndy. The great thing about hand and upper extremity surgery, and one of the reasons I fell in love with it, is just the variety of what we do. So we really get to treat everything from the fingertip all the way up to the shoulder, and get to stay on the cutting edge of all the techniques related to that. I think that patient care and evaluating a patient and deciding how best to treat a patient really comes down to listening to the patient. There's no cookbook in medicine. There's no AI can only do so much. Google can only inform so much, because what you really need is when you talk to a patient, first we have to kind of understand what their concern is. Is it a bump that doesn't hurt and they just want to make sure they don't have cancer? Are they having pain every day that's affecting their quality of life and they can no longer function? Are they being woken up at nighttime with a numb hand that they have to shake out? So we of course have to figure out what's wrong with them. We have to figure out how it impacts their life, and then use that information to really determine what the best course of treatment is. Kind of the meaning of patient care is really the fundamental reason that we do what we do. And orthopedics oftentimes isn't life or death, but what it is, it's quality of life. And we have patients who are suffering, have pain, can't do what they want to do. They have injuries that take them out of their ability to work or support their family or do their sports or hobbies. And we get to bring them back to hopefully get back to what they're used to doing and restore their quality of life. That's what the value is for me, getting to hear them and after the fact, really appreciate how they're not suffering like they used to suffer. I think we're a really special place, with what we do in hand and upper extremity surgery, from the teaching side to the patient education side to being on the forefront. And the key is just, the passion of loving it all. So whether it's a small injury in the fingertip, whether it seems like it's not important, or whether it's the worst thing that ever happened in your life, it's impactful. It affects who you are and how you're looking at life, and we just appreciate the ability to help patients kind of get to the other side of their concerns, their pain, their injury.